Good afternoon, District 7670. DG David Waechter here, leading the way for a polio-free world. And today we've got a wonderful speaker, opening opportunities to serve across our globe, in our communities, and in ourselves. We're providing mobility through wheelchairs in other countries and here at home. We're working in food banks and distribution points of food across our district. We're supporting our veterans and our frontline workers. We're providing coats and blankets to those in need this winter. We are opening our hearts and minds to be more inclusive in our clubs and to those we serve. And I thank you all for your service this year and everything that you are doing to make District 7670 a wonderful place to be a Rotarian. And today, we are welcoming a person who embodies the heart for service that we all aspire to. A person recognized around the world for their contributions to humanity and a true Rotarian. And we are blessed to have this speaker with us today. Now, I want to just, before we get to that, I want to set the stage a little bit. It's been a while since we had polio in this country. And for some of us, maybe it's hard to remember. I myself remember being afraid as a little boy and thinking that seeing the pictures of children in iron lungs and things like that, and with the braces and crutches. And I remember being very afraid of that because I was very much involved in going outdoors and playing and being with my friends and things. And I asked my mother about it, and she said, no, you don't have to worry. You've had the vaccine. You won't have to ever worry. And, you know, I still had a little bit of concern, but it eliminated the worry. And that's what we're doing for children around the world, eliminating that worry. Please allow me to show you a short little video about our district and polio. If you will bear with me, I'm going to share this. I want you to know that the last case of wild polio in the United States was in 1979. That's a long time ago. And today we are meeting with someone who has announced the last case of wild polio on a continent, another continent. And we lack only one more continent to eliminate this virus from. And today I want you to know that we did this because of Rotarians, the World Health Organization, the UNICEF, the Bill and Melinda Gates Foundation, and all of the work of people like yourselves around the world who made this possible. I want to thank Dr. Tunji Funsho for joining us today, for his wonderful and inspiring visit. Our hearts are joined in this battle. We as North Carolinians, we know the past that we have had, and we appreciate the work that he has done. Now, a new miracle has happened. That miracle is that polio is out of Africa. And we are so happy to announce that this year. A few housekeeping items. This meeting is being recorded, and it will be made available for you to share with your friends and neighbors and your fellow Rotarians as a program or on social media if you desire. Please keep yourself muted. That way we can have no interruptions. And please put your questions in the chat room, and we will address the questions at the end of the session. And with that, I would like to welcome our program leader today, and I now yield the floor to Past District Governor Jim Efland.
I know you've all read the bio on Tunji, so I'm not going to go through it in detail. It's been distributed by our Governor David. But I do want to tell you about visiting there. About 13 years ago, I was given the opportunity for one of the most impacting events of my life. I was selected as the team leader, Rotary team leader for a GSC team to Northern Nigeria to visit Rotary District 9120. We were sent to Nigeria by our then district governor, Bill Shillito, and to represent all the Rotarians in District 7670. Now, Nigeria is the country with the largest population in Africa and encompasses 140 ethnic groups forced together by Europeans in the early 1900s. It is a mixture of all the world religions, but the area we visited in the north was predominantly Muslim. The Rotarians in Nigeria are among the most fabulous and friendliest folks I've ever met. It was the spring of 2008 and the presidential primaries were in full swing in this country. Nigerians everywhere knew all about our elections and the primary candidate, Barack Obama, whose father was a native Kenyan, and they were really excited about this. During the GSC, we spent a month traveling about 1,500 to 1,800 miles visiting Rotary clubs in cities and towns such as Abuja, Makurdi, Bandiak, Bachi City, Jos, Zaria, Kano, Kaduna, etc. We visited dozens of Rotary clubs and met hundreds of Rotarians. These folks, I can tell you, are passionate about Rotary. We went to a slum area in the outskirts of Kaduna where we visited a small school to participate in polio immunization. Y'all may have seen some pictures that Governor David sent out showing some of these students. We walked into a classroom of 5-year-old boys and girls, and immediately every one of them started crying. They'd never seen a white person and wanted to touch our skin and hair to see if we were real. The experience was surreal, I can just tell you. We really saw the difficulties of eradicating polio in Nigeria, especially when the men in the village we were in ran us out. I remember thinking that the full elimination would be impossible in a country such as Nigeria. However, the most significant experience to me was that we were totally submerged into the culture, and I had the opportunity to stay in the home of 3 different doctors where we discussed and learned the culture and views we had of each other's countries. But I must that my stay with Tunji was perhaps the most memorable experience that I had in Nigeria. Tunji has a beautiful house and grounds, and in the evenings in his TV room and listen to the primary returns on 5 different channels. And it was really a fabulous opportunity. We also talked about historical significance of the Europeans dividing up Nigeria and the control of Africa and the lasting impact to this day. We discussed cultural differences and Western effects and the Cold War and world events and Nigeria's, and in fact, all Africans. Suddenly, while we were sitting in the TV room one night, Tunji reached over and grabbed my arm and said, Jim, you did not understand. You put corn ethanol in your automobiles and children in Nigeria go hungry. This one statement by Tunji forever changed my life. In my 70 years, I have never had a statement that so changed my life. And I would really like to thank Tunji for this, for giving me this new insight of the world. I think more than any event that this one statement opened up my eyes as to all we as Rotarians could do, not just in our communities, but around the world. So thank you, Tunji.
Tunji, thank you for being here today. And thank you for being such a fine host to one of our best Rotarians, PDG Jim. And thank you for your gracious attendance today. Please take the floor with your presentation. I hope you're able to see it on your screen.
Yes, thank you very much. I hope you can hear me.
Yes.
Great. Thank you very much, Jim. I have very, very, very fond memories of visits, of your visits with us and being in our home. It's one of those experiences that allows you to really know and feel what Rotarians all over the world feel, that humanity is one, that the tribe of people who are less fortunate than us is one tribe across the world. If you are deprived, you are deprived. Doesn't matter whether you're in North America, South America, in Africa, or in Asia, the needs are the same. Putting food on the table, putting roof over our heads, and having the basic minimum for survival, which is basic education and basic health care. And that is why right from the beginning, I joined Rotary in 1985 when we started the fundraising. And I have been privileged to be involved in the program since then till date in different and various capacities, which I must add has been a great addition, to my life experiences and a great opportunity that Rotary has given me to actually be part of this great movement to eradicate polio from the world. So thank you very much, Jim, for that introduction. This first slide is to highlight the most fundamental part of our polio eradication effort, which is whatever we're doing is just to get those 2 precious drops of the oral polio vaccines to the mouth of vulnerable children. And in this instance, we're talking about children below the age of 5. So whether we are fundraising, whether we are advocating, whether we're creating awareness, and whether we are actually in the field like Jim did when he came to Nigeria and putting drops in the mouths of children, that is the ultimate goal. And that ultimate goal is what is going to lead us into ensuring that no child again is ever paralyzed by the white polio virus. Next slide. See, when we started this effort in 1988, with the World Health Assembly proclaiming polio as a disease that needs to be eradicated, and most of the countries that were part of the UN signed up onto it. Even WHO themselves were very skeptical about the possibilities. But here we are. Nigeria is polio-free, as announced by WHO in August. And that essentially is thanks to Rotary, because we started this movement. We convinced WHO about it, and WHO took this to the World Health Assembly, and it became a world project. And Rotarians have remained to be the catalysts, the advocates, the funders, and the greatest creator of awareness amongst our members to make sure that the promise we make to the children of the world is kept until polio is eradicated from the world. If you are still hearing me, again, Isaac will know what has just happened. Main power supply has just been cut off.
Yes.
So you can see that I'm a little bit of darkness, except from the reflection of the light from my computer. Now the standby generator is on, so you can see me clearly again. So we always have backups in this environment. So thanks to Rotarians across the world. You know, as DG David just mentioned, you've not seen any case of polio for 40 years. And yet Rotarians in the United States have continued to be major contributors, particularly in terms of funds to our polio eradication efforts. That is not only salutary, it is exemplary. And despite staying at home and contributing funds and advocating, groups like that of Jim and quite a few others, and Lee Hussey has, brought teams here, past RI director, Howard has also, brought teams here, and a group of other Rotarians have done the same thing at their own expense, sparing their own times to be part of this program. So I want to thank you all for all you have been contributing so far. Next slide, please. The next slide shows where we were when we actually started the program proper in 1988, and where we were in 2019 when this slide was produced. At that time, Nigeria was not certified polio-free. We were not certified until August last year. But during that period of time, we have spent at least 15 billion on this program. We've used 20 million volunteers, including Rotarians, and we vaccinated up to 3 billion children worldwide. Recently, in the last week, Pakistan immunized in just one region more than 40 million children. Nigeria immunized 25 million children in the last 2 weeks. And all over the years of these our efforts, we have saved 1.5 million lives of children. But even more salutary, and this is what gives us confidence that we'll eradicate polio. Of the 3 strains of the polio virus we started with 3 strains, type 1, type 2, type 3. We have eradicated type 2 and type 3. So we only left 1 virus. Therefore, there's no doubt in my mind that if we continue doing what we're doing and also continue to innovate in the face of any new challenges that crop up, we're going to see the end of polio in a very short period of time, and I'll explain that in a minute. Next slide. So we didn't get, here by just chance. This is just breaking down some of the figures we've had. In 2020, you can see that we had 140 cases, both of them in Pakistan and Afghanistan. 84 cases in Pakistan and 56 in Afghanistan. But the good news about that is that half of those cases occurred in the first half of 2020. So by the second half of 2020, we had much less cases, which is following the usual trajectory when we are going to 0 cases of polio. It happened in Nigeria. It happened in India. So we expect the same to happen. And in all probability, looking at what is on ground, we're most likely going to see our last case of polio in Pakistan and Afghanistan in 2021. Next slide. Because we didn't get, here just by a stroke of luck. We got here by dint of hard work. That is CDG Isaacs and his team in our Rotary Center in Lagos when they were here with us. These are contributory factors to our success. And I just thought I should show this slide. The next slide is that of Jean, I think. Next slide, please. Immunizing in, I think it's Abuja. These may appear, subtle. They may appear inconsequential, but they gave Rotarians in Nigeria the motivation to continue despite all the challenges. And we did have a lot of challenges. But these activities, of your districts and other Rotarians across the United States and other parts of the world made us appreciate that we're not alone. There are people working with us. At the same time, people watching us to see what we bring to bear to ensure that we put a lead on the escalation of polio cases in Nigeria. And this contributed to those fantastic figures you saw us gradually getting to 0 cases in Nigeria. Next slide. You can see how badly we were doing in the early 2000s because we had some governments in the country, state governments in the country that boycotted immunization totally. Part of our challenges, vaccine rejection, eventually we overcame that through Rotary and also through the efforts of the government. Such that we saw 0 case for 2 years, from 2014 to 2016. But of course, the insurgency in the northeastern part of the country made it impossible for us to meet and immunize a cohort of children in those 23 to 24 months. But thereafter, when we saw our last case in 2016, we have since not seen a single case. And this is in the presence of very robust surveillance system, which will pick up any case of acute flaccid paralysis. Stool samples are collected within 48 hours of that discovery and sent to reference laboratories to see whether this paralysis was due to polio or not. And this, though there were some setbacks in surveillance during the COVID-19 initial stage, we are back on track to ensure that any case of paralysis anywhere in Nigeria is picked up. And we have not seen any single case. However, you may have heard we've had some cases of vaccine-derived poliovirus. This is a much broader subject, but I think I should mention it in case you read about it in the media, or that there's still polio. Yes, there are still some cases of children being paralyzed, but not by the wild poliovirus, but by vaccine-derived poliovirus. The vaccine-derived poliovirus is a mutated vaccine virus. It is not the virus in the vaccine. It is very rare, 1 in a million, that a child receives a polio vaccine and the vaccine paralyzes the child. The vaccine-derived poliovirus is a virus in the vaccine that has been circulating in an environment that is unhygienic and has passed through unimmunized children a number of times. Every living being tends to adapt to survive. And that's what the virus has done. And we now have a very potent tool, which is a new vaccine, new oral polio vaccine, which we call the NOPV, the novel vaccine, which has been rolled out now, which is much more stable. It's unlikely to mutate and cause paralysis in children. So that is our new weapon against vaccine-derived. And the good thing about vaccine-derived is once you mount a robust outbreak response, usually within 6 months, you can put a lid on it. Next slide, please. So these are the thematic areas of activities that has led us to this success. Advocacy. This is one area Rotarians are unique because we have the contacts, we have the knowledge, and we are everywhere. There's a phone company in Nigeria called MTN, and their major slogan is, everywhere you go, we are there. And that is one unique thing to the Rotary movement. Any nook and cranny of the world you go, you will find a Rotarian. So we can advocate right from the top level in government to the lowest level in the communities in which we live. And we advocate not only to opinion leaders, we also advocate to Rotarians, because since this program started, hundreds of thousands of Rotarians have joined us. At the same time, of course, we all know, some have left. So we owe it to these new Rotarians to advocate to them so that they know how we started, what we have done, and what their role needs to be. We continue to create awareness and mobilize our communities through opinion leaders, through celebrities. I'm sure you all know we have different celebrity ambassadors across the world who help us propagate the need for children to be immunized. And very important, polio eradication costs money. As I mentioned, we spend, as a matter of fact, right now, we spent about $2.1 billion US, Rotary money, including the Gates Foundation match. But the total expenditure with the GPI partners and also countries, and the United States of America is one of the highest donors to the Rotary eradication efforts, about $21 billion and still counting. It is estimated that we would need for next year alone, almost, well, we're already in next year, 2021, we'll be needing about $1.8 billion US, because we need to continue doing surveillance. We need to ensure that we have good stock of the new vaccine. We need to ensure that also some of the logistics that are associated with getting the vaccine to the children are provided. So fundraising, I'll talk about that in a little more detail. And of course, as you have seen, we continue with our field activities. As I mentioned, in the last 2 weeks, in Nigeria, we have immunized 20 million children over 2 weekends in 4-day periods. Now, these are some of the challenges, just giving you an idea of what Rotarians and other volunteers go through in order to get the vaccines to children. These are in riverine areas. You cannot reach children except by this kind of boats. Next slide. Just showing something similar. It gets more and more. These are flooded areas where vaccinators really had to wade through hip-high water, virtually totally unprotected. And you can see this volunteer vaccinator having not only to carry his vaccine, but also to carry the bike on which the vaccine carrier is strapped. You can see another volunteer vaccinator neck deep in a river that has risen due to heavy rains. We just needed to get to the children. Next slide. Just more of those kind of difficulty in accessibility. Now, this is the ultimate, because at a point in the northeastern part of the country where the insurgents were still very active, Many roads were not passable because of ambushes by insurgents. And so we needed to reach communities by helicopter. On the left is myself, one of my vice chairmen on the committee, and our technical national field coordinator. This is a distance that normally by road will take about 2 hours, which is, short distance in this environment, but there's always the risk of ambush. And we've had quite a number of our GPI partners being ambushed and actually lose their lives in trying to navigate those roads. So United Nations provided these helicopters for us to be able to hop from one city to the other to ensure that vaccinations are taking place and the quality of the vaccination are high. Next slide, please. But as part of our advocacy, this is my committee during the visit of President Barry Racing and Esther, with our President Mohamed Buhari, who has been a very strong supporter, both in words and in deeds and in funding for the polio eradication efforts in Nigeria. He took the opportunity to give him the award that is reserved normally for heads of state, which is the Polio Champions Award. Thank you. So that was one of our most major top-level advocacy efforts in recent years. Our funding, as some of you may be aware, goes directly to WHO and UNICEF based on budgets they present to the IPPC. They usually come to defend their budgets to the IPPC. We had a meeting with them to defend the budget for this half year only, how many days ago? Only 2 days ago. But we try to make a show of this. This is us presenting the check to the Minister of Health for Nigeria 2 years ago. This is the UNICEF check, and that's the lady is the UNICEF country representative, and Dr. Anis there is the chief UNICEF polio person at the time. And the gentleman in the blue shirt is my vice chairman, who is based in Abuja, the federal capital. So our funding essentially goes not to government directly, but through our GPI partners, WHO and UNICEF. This is our creation of awareness. We usually have road walks to raise funds and also to create awareness. And this happens all over the country, particularly around the World Polio Day, 24th of October. That's me on the left with my paddy, Lapis, and some of my club members on another creation of awareness event. Next slide. We've had challenges, no doubt about that. You must have read a lot about it in the press. One is, was vaccine opposition. That has reduced tremendously. Those are very fringe and they don't affect our programs. We've always had issues with low routine immunization because of poor primary healthcare infrastructure. And of course, the insurgency came and made things worse by creating inaccessibility to children, particularly in the Northeast. And then, the difficulty in raising funds. Next slide. Our current challenges is very majorly, which is taking a lot of our time, energy, and resources, is low routine immunization. Is vaccine-derived, polio virus. And then the next, low routine immunization, coverage. Because currently in Nigeria, and in most parts of Africa, the average coverage for immunization is about 50%, including the oral polio vaccine. Now, in the face of saying Nigeria is polio-free and Africa is polio-free, it's getting more difficult to get governments and donors to give more money, because you get the rhetorical, question. I thought we've been certified polio-free. We have other priorities. So we need new innovative ways and means to convince both Rotarians and our donors to maintain the current level, if not more, of funding. And of course, we need to continue advocating with our governments around the world to sustain the political will and commitment until the world is certified polio-free. So what must we continue to do? We need to raise funds to meet the Gates challenge. We have a new commitment with the Gates Foundation up to year 2023. We managed to raise for the last year the 50 million. We're almost on track, on time basis to meet our commitment this year. But that is something that we really need to work harder at, because both Rotarians and government, as I said earlier, are thinking of somewhere new to go. But until we finish polio eradication and the world is certified polio-free, this is our commitment to the children of the world. And Rotarians are known to be people of their words. So we need to continue raising funds so that we meet the Gate challenge. And then our advocacy activities are going to become stronger. We need to, in the face of the pandemic, also look for innovative ways to engage, to advocate for polio eradication at the same time, as I was talking in a minute about involving ourselves with COVID-19 prevention and immunization. We'll continue to create awareness through the media and through all resources that we have been used to. Rallies are going to be a little bit more subdued because of the pandemic, but we just bear in mind these are available until polio is eradicated. A lot of clubs do not have polio plus structures. In other words, there's no polio plus committee. This is something recommended by RI, and we need to encourage clubs to ensure that they have an active polio plus committee, which will carry out some of those thematic responsibilities that are enumerated earlier. This is just an exhortation. So fundraising, very, very critical at this stage. And sometimes Rotarians will ask, how is this money spent? So I just put in this slide, to give you an idea of how, the global polio eradication budget is spent by activity. You can see that the largest is for campaigns. What do we mean by campaigns? Campaigns are when we take the vaccines and go house to house in designated areas to make sure that every child in each household in that particular locality gets the polio vaccine. It's a huge logistic undertaking. As I mentioned earlier, we had 2 weekends in succession that we did that. And you can imagine what it takes to immunize between 20 and 25 million children over a period of 8 days. You need the vaccinators. Every team of vaccinator has 3 people. Most states would have at least 15,000 of those teams. If we do a national immunization in Nigeria, we have 36 states plus the Federal Capital Territory. The next is what I mentioned earlier about making sure that there's no polio anyway, surveillance. You can see that between those two, we are reaching almost 60% of our budget activities. So this is, looking at that pie chart, this is how the funds are spent. So Rotarians may still ask, we've eradicated polio, but we are still doing campaigns. Surveillance remains very key, apart from some of the other areas you can see on the pie chart. So just to buttress my point about campaigns, even though Nigeria have been certified polio-free, you can see that we've done 1 set already. We still have about 6 campaigns to go before the end of this year. And one of those campaigns is national. If you look at the first line there, we are planning to immunize 56 million children over a period of 4 days. And that's a huge logistic challenge, but we're used to that, but it costs money. So these are the campaigns that are slated till the end of this Rotary year. So I want to talk briefly about the impact of COVID-19 on our polio eradication efforts. For most of last year, from about March, it was agreed with DPI partners that we should pause community social intervention, which is our campaigns, and also pause the response to the outbreak to vaccine-derived. Now, vaccine-derived, you need to move in there quickly, otherwise it spreads. And that is why, we've had the vaccine-derived polio virus spreading from barely 5 countries at the beginning of last year to 27 countries as I speak. But we are back on track. A lot of countries started again in July last year to do outbreak responses to prevent further spread of the vaccine-derived polio virus. So the GPI directive that we've bought into is to leverage our assets to support COVID-19. We've been doing that a lot. A lot of our field workers in Nigeria, we have what we call, community volunteer mobilizers. We have about 22,000 of them in the country who actually engage with families to ensure their general well-being. They are now being used to educate about prevention methods to ensure that routine immunization, including polio, continues. And of course, also to keep our polio infrastructure oiled to resume the house to house as soon as the pandemic started to subside. But we couldn't wait for that, so we started our outbreak responses since July of last year. We need to support the government's program for alleviation and mitigation and containment of COVID-19. And part of what we have done here is to provide food palliatives across the country by Rotary clubs and the National Polio Pulse Committee, provide face masks, and also advocate for Rotary clubs to provide face masks and distribute to their community, and communication to the public using flyers online, virtual bead balls, solid bead balls, and regular TV appearances. And we've now been asked by RI to participate in vaccine uptake advocacy. And different countries and different districts at different stages of ensuring that this is the case. We're a little bit reticent in Nigeria at the moment until we are sure when the first batch of vaccines will arrive and how adequate it will be to cover communities, so we don't have a backlash of advocating and people don't get the vaccine. Next slide. These are some of the images we put up, in the early parts of the COVID-19 pandemic. These are some of the flyers we put online. This is part of our food palliatives distribution. And those are samples of the face masks that we produced and distributed across the country. This was done by funds from the Rotary Foundation. So in essence, what we are focused on doing now is keeping polio at zero in Nigeria and Africa, bearing in mind that we are in an era of COVID-19. So advocacy for that continues. So stay at home if you don't have to go out. Wear your masks, wash your hands or use hand sanitizer, but also, as you can see at the top left-hand corner, continue our immunization program. So final side is to thank you all very much for what you have been doing and what I believe you continue to do to ensure that Rotary keeps its promise to the children of the world that no child will ever again be paralyzed by the wild polio virus. Thank you very much for inviting me.
Thank you, Tunji. Thank you, Dr. Funsho. We have one question so far, but this question is, please explain, of course, I think maybe this has been answered, but maybe you just want to reiterate something about how why we need to continue to raise the funds for vaccination. I think you covered that pretty pretty well, but maybe just hit a high point there. The most important reason.
I think the most important reason now why we should raise funds is we still have 2 countries that are still circulating the wild polio virus. Those countries will need funding for campaigns, as I mentioned earlier. They will need funding to have good surveillance system to track any case of polio and cover it up with immediate outbreak response before it goes much wider than that, community. The other area that we've become involved in recently is the new polio vaccine. We've had to make funds available also for the new vaccine stock. We've not funded vaccines for quite some time, but there are so many outbreak responses that we require to make sure that we do not fail to meet the requirements for outbreak response, because these outbreaks don't give you notice. And you need to mount a response in this new climate that we're in, since we are not able to go to the field within 2 weeks at the maximum. Otherwise, it will spread and it will cost much more. Surveillance also costs money. And we also approved recently to WHO more funding for surveillance. But a lot of our cost is going into actual getting the vaccine to the mouth of the children in these 2 remaining countries, and also in a lot of African countries. As I've shown you in Nigeria, we're going to do house-to-house immunization for another 6 rounds in different parts of the country, and 1 all over the country, the remaining of this year.
Thank you. What are some ways that we can assist other than raising funds?
Advocacy. I think Rotarians need to continuously be informed about what is going on. That way, they are motivated, to raise funds. If people don't know, and that's why I love the question that was asked, despite the fact that, I explained it before. If people don't know why you're telling them to do what they should do, the likelihood of getting a buy-in is very slim. That is one. Advocacy to governments. As I mentioned earlier, and we have a very good advocacy team led by Ann Matthews to the American government. And they have been doing wonderful work in ensuring that the United States government continues to provide through the CDC funding for polio eradication. And then advocacy, to opinion leaders in our community and those who have the wherewithal to donate funds. Let them see what we're doing so that they want to be part of the end game, which is being there when the world is certified polio free, and they can say, yes, I was part of it in real terms. I did donate some funds, or I helped in advocacy for some funds to be made available for the polio eradication efforts.
Thank you. And the last 2 questions, I'm going to pose them as one. First, you are very close to the quote unquote higher ups of polio eradication with all of your wonderful work. What do you know about their estimations on when polio will be eradicated? What is their best guess? And then, how long after that eradication do you think we will have to continue raising funds and vaccinating to prevent a resurgence?
Well, in order not to create a situation of complacency, the Rotary leadership, particularly the IPPC and the trustees, are not giving any definite answers to that question. All I can say is from the evidence we have on ground and from recent discussions with the people on ground in Pakistan, and also from a recent address by the WHO polio president, the new guy Makuleri, is that looking at what happened in Pakistan and Afghanistan last calendar year, the number of polio cases in the first half of the year was twice what we had in the second half of the year, despite the challenges of COVID-19. And we looked at the records in India, we looked at the record of Nigeria. That is the general trajectory. And with the new changes, to the polio structure by the GPI in Pakistan and Afghanistan, in my estimation, it will be not too far-fetched to believe that we'll see the last case of the wild polio virus in Pakistan and Afghanistan this calendar year.
Mm.
Now,
Yay.
having said that, I'll go to your next question. The end game is that once the world is certified polio-free by WHO, which will be 3 years after Pakistan or Afghanistan, or both of them rather, have been certified polio-free, then we are going to go through a process where the oral polio vaccine, which contains a live vaccine, is going to be withdrawn from circulation. And it will not be replaced with the injectable Salk vaccine, which is a dead virus. In other words, we do not want a situation where we have any infective polio virus in any form in circulation. They're going to be withdrawn. And that will be dependent on different countries and the availability of these vaccines. So from world certification, Rotary will gradually now technically withdraw from funding the polio eradication effort, because what we have committed ourselves is world certification of polio-free worlds. Then it's going to be left to us to, in our own localities, advocate to make sure that the switch over from oral polio vaccine to IPV, which is injectable polio vaccine, continues. And different countries are going to get to a point where they can now be convinced, of course, with the guidance of WHO, that polio immunization can now stop. But again, surveillance will still continue in those periods of time in those affected countries.
Thank you. I said last question, but I really like this one that came to me privately, and I think it's a good question. I appreciate and respect everyone's time. I know we're approaching 1 o'clock local time here, but this is a wonderful question because it's informative to people on this side of the Atlantic. When people are delivering the vaccine and they are attacked, what are the motivations of the attackers? Why do they do this? Can you explain that?
Well, fanaticism is not restricted to any band of ideology. Some people have been conditioned to believe that the vaccinator is coming to harm their children, either because their local influencer has told them, or their religious leader has told them, or their traditional leaders have told them that these people are coming to harm you. That is the fundamental reasons why you get these attacks, happening. We had that in Nigeria. We needed to use traditional religious leaders, to put a lid on it. We're still having it in Pakistan. I believe just about a month ago, we had security, agents and a vaccinator, were murdered. And this is out of a false belief that you're not actually coming to help them, that you're coming to harm them, because somebody they believe in, who is influential, has told them so.
Thank you for that. Dr. Funsho, I want to thank you from the bottom of my heart for you coming and being with us today. It means so much to me. It's hard for me to convey through this media of video how much I appreciate you and And I know our district, I can see the faces, and I know they very much appreciate the time you spent with us this evening, your evening, our afternoon. And it's so nice to be so far away, but still be so close. Thank you so much. And I would like to yield the floor to PDG Isaac to offer some thanks from us.
DG David, on behalf of DG David and the entire District 7670, I want to thank my big brother, Dr. Tunji Funsho, for coming to our district today to speak. For many of you don't know, Dr. Funsho is an extremely busy person. In fact, Times Magazine recognized him as one of the top 100 men who influenced the world last year. And so it's extremely busy. And for you to honor our district by coming to speak here today, thank you so very much. And on behalf of your presence, everyone that have registered here, they have contributed $10 or more, some $100 or more to polio, to ending the polio, which you devoted almost more than half of your year working on. This man is a well-trained doctor, and in spite of that, he left his career aside to work on behalf of Rotary. Thank you and your family for your dedication to the children of the world in eradicating polio all over the world. District 7670, and on behalf of David Waechter, we salute you and thank you. And I turn over to DG David. Thank you.
Thank you very much. Thank you.
Yes, sir.
Thank you. Thank you, Isaac. Thank you, Dr. Funsho. Thank you, PDG Jim Efland. Thank you, our entire team who made this possible today. And we will have the recording put on YouTube, our district YouTube channel, for sharing among our friends and family who were not able to attend today. This is a fabulous program. I know we're going to see the end of polio in the entire world very soon. I'm very encouraged. And I thank you once last time before signing off and saying good evening. And
thank you all. Thank you all very much indeed for having me.
Amen. All right.